it coming out of the socket.
Right.
Very indistinct, but here it is in. It's right here. There's the ear. There's really no space, but
Yeah.
you can see that this is, again, really put upon. Did you ever get in an accident, fall or hit your head or hit your face or your chin or anything like that? Nothing you can remember?
No, but there's a lot of trauma because of her dancing. And
Well, that's what I'm asking.
And her part of her dancing was acrobatic, like acro, and they used to toss her. She's the one that got tossed, and then when she lands, the floor is not equipped for
is it
such
wood,
force.
or is it cushioned? Or?
They had a mat a little bit, but it's not. It's not
Your
like
ankles,
for
have
gymnastics.
you ever hurt after that? When you get tossed and stuff like that? Or your legs?
I used to have like my left knee, like I used to have problems with it.
What was the problem?
I would just have sharp pains like every time I would walk.
And you were how old?
It was during like 17, 18.
So 17, 18-year-old
Yeah.
with sharp pains in your knee, that's not supposed to happen, right? Okay. Yeah, you can see this condyle. Look at the shape.
Mm-hmm.
I'm getting a little better definitive here. Here, watch this, because it comes up, and it's really mushy in here.
Right.
There's no
right,
space.
Right.
And
right.
so there's the indent or the concavity right here, and then it comes back down.
Yeah.
It's not supposed to look like that.
Right.
It's supposed to be nice and round, and you're supposed to have
Yeah.
space. And you don't have any of that on any of your sides. And my God, the orthodontics is just going to make it so much worse. The right side looks like a little more space than the left. Which is your worst side?
Yeah, I get clicking on the left side.
Okay, so the left side, okay, the right side's a little better. You've got some spacing, yeah. I'm Dr. Paul Ancelera, and I have a patient here with her mom, and so I'm going to let Ada explain why Asia is our patient. Go ahead, Ada.
Hi there. This is my 23-year-old daughter, and history is she is a competitive dancer since she was 6 years old. She did competitive for a good 17 years.
Wow.
Now, at 15 years old, we did orthodontic treatment, top and bottom braces.
Which included what?
Which included first her bicuspid molars were extracted, and then we did the top and bottom speed bracket braces, and also did she had elastics from canine to bring her jaw forward. Now she had a treatment for 2 years, and then after that her bite was perfect, and also the alignment of her teeth was perfect. 6 months later, I started noticing that she had an open bite, right? And then an open bite gradually worsened. So the dentist that did the braces, I asked for a referral to an orthodontist, and the orthodontist checked and said, yep, she does have an open bite, a 5 millimeter open bite, over jet of 5 millimeters. And then also Asia started developing some pain around her TMJ clicking.
Left side.
And then she would get headaches, and anyway, so we went to the orthodontist, referred her to an oral maxillofacial specialist. The specialist saw Asia, did another x-rays, and at that time he checked and he concluded or diagnosed, preliminary diagnosis was idiopathic condylar resorption, and then he also said that he would like to check for a bone scan to see if her condyle was active. So that was at 18 years old. We went to a bone scan, and it showed that it was still mildly active, her mandibular condyle. So he said that, the specialist said that let's hold off for another year and revisit her again until then. And then at that time he said the wisdom teeth has to be extracted, and prior to that too, Aisha was given a mandibular splint just to lessen the load on her back teeth from the dentist, which helped because at this point in time she was getting a lot of pain, like on her neck and also her headache. And yes,
Okay.
so
Let me get to her now.
yes.
All right, so the reason you're here, you're my why, or why my, whatever you call it. Okay, your reason to be here. What is your first reason to be here?
Headaches. I
Okay,
get a
and
lot
you
of
get them
headaches.
how often? Every day?
I would say like, yeah, every day.
Are they by the side of your head, behind your eyes? Where are they behind
They
your head?
resonate like back here
Back here.
or
Yeah.
my temples
So,
sometimes.
right. Okay. Okay. And the before bicuspid extraction we see a lot of here because they didn't bring her lower jaw forward. They tried to pull her upper jaw back. That's kind of what those class 2 elastics do. We already see by the tomograms we took, we didn't go over them yet, but the tomograms are showing that the condyles are posterior and superior in the joint fossa, which means that she has no space to move her jaw properly, and the muscles have no real range of motion to work properly, so they're real tight. And that's what caused the open bite, the real tight muscles. Real tight, when muscles get really tight like that, the bite opens.
Right.
And putting braces on doesn't make it better, okay, because you're not working with muscle, you're working with teeth. We've had a number of those open bite cases, and again, you have to satisfy the demands of what muscles need, and once you can do that, then we can work with, at some point work with the teeth and close the bite down, because this kind of bite won't work. I mean, symptomatically, she's sick. She's got symptoms. That's why she's sick. Okay, so we're gonna start measuring. Let's get to measure. I've had a surgeon here, very prominent, one of the best ones in Chicago. He was here, and we talked about that. He said, I wouldn't touch that with a 10-foot pole, because when you cut here, you're only sliding this part of the jaw forward. This part is still fixated, and as you can see from these x-rays, it's in the wrong place. And we'll prove that, and so that's why that will only make it worse.
And it's interesting that you did say that, because when that was proposed to Aisha for surgery, and I asked, what about her TMJ? And then they said, what about it? Like, is it going to help? And because, no, we're bringing the jaw forward. And
for
then,
aesthetics.
Yes,
Yeah.
so.
That doesn't work. Okay. My experience, I shouldn't say he's so flat out black and white, but you're not changing the joint, you're not changing the muscle, you're moving teeth only. I've been doing this a long time. In order to do what we have to do, we have to honor the demands of what our muscles need. So I want you to open best you can. Okay, Ryle, she's at 40. Did that hurt? Okay, bite down again. Slide your jaw to the right as far as it goes. Atta girl. She's about 8. Did that hurt?
No.
Okay, go to the left. Same thing, about 8. Any pain there?
A little bit.
Where?
Here.
Going from right to left, she has pain on the right side, right in this area, or higher?
No, right there.
Right about in the masseter level. Okay, bite down again. Slide your jaw forward to your edge to edge, right there. Now you can see her bite is open.
Yeah.
Okay, your edge to edge. She's not hitting her teeth, her front teeth don't hit, but she's between 24 and 25, 8 and 9. Now I want you to slide your jaw as far forward as you can. Is that as far as you can go? And she's about 3 or 4 millimeters protrusive. Any pain there?
Here.
Right. Right in the posterior digastric region on the left side. Okay. It's time to do posture. Stand up. Let's look. So here we go. Left ear. Wow. 5 centimeter left. 6, 7, 8 on the right. Come a little forward, honey. Oh, you know what? We'll do it this way. So I want you to go to the wall. And that's all right. Oh,
Yeah, she's got it.
Okay, that's fine. And just hands at your side. Whoop, I want to get out of that way. Okay, and yeah. We had 7 left. Now I'm not sure. Let me look from a distance. Oh yes, definitely left. Left hip, left shoulder. No question. Okay. Turn this way. Watch what TMJ patients can't do. Your chin, your teeth together. Try and touch your chin to your chest. See, she can't do it. Nobody with TMJ can do that. Okay, come on back. Turn your head to the left as far as it goes. Any pain there? She's got pain on the right cervical going from left to right, and she's moderate. Come on back. Go to the right. That's worse, isn't it? She's going left to right, which is worse, and it's real tight in here. Any pain in here? Okay. All right. Let's look at me a little bit. Left eye's higher. Lip pout, mentone crease. We'll just talk about that. Gonial deposition, bilateral, and she's got masseter hypertrophy, which means swollen muscle. Okay, so we've got all that. And he's 23. Okay, and she has a decided retrognathic chin. Okay, have a seat. All right. She's had wisdom teeth out, and she's had 4 bicuspid extraction, correct? Okay,
Yes.
so her first bicuspids have been taken out, so she is, instead of 32 teeth, she has only 24. Okay, open, babe. Best you can. Yep. Yep. Can you do me a favor? Just lift your head up a little bit. Put your tongue to the roof of your mouth. A little bit of a tongue tie. Moderate tongue, a little bit of a tongue tie. Okay, but that's not the biggest problem. Okay, open again. And say ah. Do it again. Stick your tongue out. Let's see. Now do an ah. I'll give her a 2 to 3. Do you snore at night? Okay, she snores. She needs a sleep test. Take home sleep test. Okay. No child, no anybody should be snoring. And the fact that I just did what's called a malum patti in her mouth means I'm looking at airway. That's where you look for airway, or intraorally. And we're not seeing much of anything as far as an airway. I'm seeing a little bit, but I'm not seeing something like I should see on somebody her age. But we need to know if she's have any problems with breathing at night, okay, which could be dangerous. So we want to rule that out. So that would be a good idea. Lift up, babe. Yeah. You can put her at the scallop tongue. Why am I seeing a scallop tongue? Seeing a scallop tongue because the tongue needs recruitment to swallow, and she's not getting it from her muscles, so the tongue's pressing against the teeth. So what we're getting is the impression of her teeth on her tongue, and that's kind of a giveaway on swallow. Do me a favor. You're going to be doing this anyway, but hold it, swallow. You see that slight inclination on her? Okay, you can say, well, it's slight. Yeah, but it's 3,000 times a day that she's moving that head when she tries to swallow, meaning she needs more help with swallow than what her muscles can give her right now, which we'll prove on the K7, which is the way we're going to go after this exam. Okay, what's next? Oh, overbite, overjet. She's got a significant overjet. Thank you very much for the custom extractions. Okay, and bite down and hold it. She got about an 8. 8 over jet, excuse me. She almost got the same thing for overbite. We had a 15-year-old from 2 hours from here in Kenosha. He came in here with a 13 millimeter overjet. And we got him to a 2 at the end. Non-surgical. So, okay, what's next?
What class?
Okay, she's a skeletal class 2. Just put skeletal class 2. So?
The overjet is worse because
It's an 8 millimeter. Again, the jaw's retruding in, and because of what she's doing, because of the dysfunction, that can only get worse as the teeth are intruded down further. So as the teeth are intruded down further, the vertical dimension, nose to chin, gets smaller, and the jaw goes further back, and the head comes further forward, which then leads us to believe that she's breathing here. She's upper chest breathing, not diaphragmatic breathing, okay, which would really help her. But she can't diaphragmatic breathe if she's here. Oh, so what was the? Give me the measurement of the forward head.
5 and 8.
Okay, 5 and 8. So watch this. Left shoulder higher.
Yeah.
Then this is 8. That's kind of her. See what's going on? Now look at my back. Well, if you could look at my back, but if you look at the back, you'll see that there's got to be a twist. So does she have scoliosis? She has to have scoliosis. You can't have, and that's pretty. That was a lot of. What was it? What was the left side? The left shoulder forward? That was pretty.
5.
And the other one was 7 or 8. 8. So
Actually,
that's really forward.
she does have 20% scoliosis that was determined at, I think at about 16 years old, because
You should have looked when she was 5. I'm telling you, because this is where,
Yes.
where it begins. Okay, you can't have what she has
Right.
and not have what we talked about. Okay, so does she need postural help? Yeah, and that's why Jamie, well, I have a PT that I work with. She texted me that she could be here at 12:30, but I don't think we'd be. I think we'd be done before that.
Right.
But she could come after work, but not till after 5.
Okay.
Maybe we'll do that and have her
Okay.
take a look at her
Yes,
with the
yes,
X-rays. So
yes.
that might be a good idea.
Yes, sure.
So we have a PT that we work with a lot. I do other, you have to do posture with TMJ because we have to get the skull over the spine. And if we can't do, I mean, we have to do that. And we're creating an environment for that to happen posturally and neuromuscularly, which we'll continue with. All right, what is next, Riley? Muscles? Okay. I know you got muscles, right? You're a dancer, blah, blah, blah. Okay, if I press on your muscles and there's no pain, then it's 0. Small pain 1, moderate 2, severe 3, and if one is worse than the other, one side, let us know, okay? All right, just gonna move your hair a little bit. All right, I'm gonna start right here. Any pain if I press right here? 1, 2, or 3?
I'd say 2.
Both sides?
Both sides.
2 on posterior temporalis, how about here?
It's
3 on the middle temporalis, there you go. How about in here?
30. Also
3? Okay, so 2/3 of from temporalis muscle is extreme.
This was more the left side though.
Oh, more the left
Yeah.
side. Oh, you didn't say that. Okay, so more the left side. Okay, but what's going on with that muscle? It's coming under the cheek, the zygoma, and it's going right in here. That's the coronoid, that's the part of the mandible. So this is part of the muscle that closes your jaw, helps the masseter out. What's next?
Infraauricular.
Oh yeah. Okay, here we go. Open best you can, and bite. Any pain?
Right side.
What number?
2.
2 on the right. Open again. Keep going. Best you can. Okay, close. Anything? No? Okay. Stay right there. You don't have to open. I'm just going to press. How about here?
Yep. 2, 3.
2 on the left, 3 on the right. How about here?
The same thing.
Same thing on the ligament. Okay, head back. Let's go do the eyebrows. Any pain on the supraorbital area?
On right side 2, and then no.
Okay, right 2 on the supraorbital on the roof. I call it the roof. Let's go to the floor. Any pain here?
2.
Both sides 2 on the floor. Let's do frontal sinus. How about in here? Nothing on frontal sinus. Okay. What's next? Maxillary, yeah. Here we go, maxillary. Anything in here?
2.
2 both sides. Oops, sorry. What we do is I go ethmoidal. How about in here?
I'd say 2.
2 on ethmoidal. Come a little forward again. Masseter's next, right?
Yep.
Here's why I have no friends. Okay. Any pain here?
Yep.
3s?
Yeah.
Double 3. How about here? Same thing, double 3. Open a little bit. Sorry about this. We're going to touch the cheek area where your salivary gland is.
Yeah.
3s again, right? The salivary gland, the parotid gland, is enmeshed in the masseter. So pressing against the duct of the parotid gland, it's surprising because patients really do feel that. Okay, what is next?
Mylohyoid.
Okay, this is not going to bother you. At least I don't think so. Anything in here? Good. Okay. Head down a little bit. As long as color, right?
Yep.
Anything in here?
Yep.
2s on that. Head back, look at the ceiling best you can. Okay, I'm just going to work down. Okay, throat is good. With particular attention to the hyoid bone, which we will talk about. All right, I want you to turn your head to the left as far as it goes. Press on my hand. There we go. We're going to palpate the SCM. Any pain here?
1.
1 in the SCM. We're going to go back to the anterior scalene. How about in here?
2.
2, and then we'll go back to the middle. How about in here?
That's a 2.
That's a 2 as well? Okay, we're going to do the same thing on this side. Hold. Okay, get your ear out of the way. Okay, here we go. Pressing a little bit. There you go. Any pain here?
1.
1 on the SCM. How about here?
3.
3 on, yeah. 3 on the anterior scalene. What about this one?
And that's a 3 too.
Yeah, it sure is. Okay, now stay like that. The scalene muscles are on the other side of this, other side of the SCM. They form like a triangle, and they come down through here. They come under this clavicle into the first rib. So they are the muscles that will help you breathing and stability of your head. But when your head is forward this extreme, they're not doing much of a job because it weighs so much more. The further out your head is, the more it weighs. And she's out 8 millimeters on the right side. Centimeters. So that rib is raised, and over time will compress the brachial plexus subclavian artery, which will run down the hand, arm and into the hand and can create numbness. That's thoracic outlet. Okay? And the Madison surgeons take out your first rib. They don't do anything with it, but when we get the posture right, like here, which we're expecting you to do, of course, that's not an issue anymore. Okay, so what's next?
Rubber table.
Okay, head down a little bit. Any pain in here?
Yeah, 2.
2 on the paravertebrals. What's next? Oh, capitals. How about in here?
Occipital.
Oh, okay, occipitals. Anything here, here, or across the top?
No.
Nothing on occipitals. How about here?
Yes, it's a 3.
3. How about here?
3.
3 on the cervices. SCM, let's see. That's SCM. Semispinalis. How about in here?
3.
3. Okay, we're going to walk up your neck. If it bothers you, stop me. You okay? Okay, good. I'm going to turn you this way. There goes. How about here?
2.
Both sides, 2?
This one's a 3, this one's a 2.
3 on the left, 2 on the right. I can feel little lumps on her left side. And we're going to do the levator scapulae. How about in here?
2 on both.
Okay, how about in here?
And then 3s.
3's on the teres area. That whole shoulder is not having fun. Yeah. This is why I like the swimming too, because the swimming really will relieve this stuff. Okay, as she's going through full range of motion, just swimming. You don't have to be crazy about it, but it just opens you up. And half hour a day, I just find it really works well. Okay, what's next?
Anterior digaster.
Okay. Again, anything in here? How about back here?
Yes, 2s.
2's on the posterior digastric temporal tendon. How about here?
3s.
3 on the temporal tendon. That's part of the temporalis muscle.
Yeah.
That's going to go into the zygoma. We're going to do the zygoma where the masseter attaches. How about in here?
1s.
1. Okay, here's the coronoid now. In order to get the coronoid, she has to open a little bit, and there's a dimple right here, and you press the dimple. How about here?
3s.
3's. Okay. What's next? Oh, pterygoids. Okay, these are not happy muscles. Okay, I'm just warning it. We'll go quick on them. Open a little bit. How about here?
3.
Yep. How about here? 3 again? Okay. How about here? Definitely 3. And again, how about here? Okay, 3. Let's do the floor of the mouth. Anything on the floor of the mouth. Okay, she doesn't have pain on the floor of the mouth, but she does have, we can use as a cervicalgia, which is pain in the neck, of course, cephalgia, headache, and she also has capsulitis. Her joint capsules are inflamed, so that's an inflammation. So those are our 3 diagnostic codes. Okay, so we're going to get that, coupled with the fact that we took tomograms of her biting and then her opening, and revealed that the condylar heads are misshapen. And she's 23, so they've been misshapen a while. She's also had a history of trauma, being thrown around as a gymnast and dancer, so we've got that included in there. It's nothing we really don't see. I mean, this is a muscle. TMJ is a muscle disease. I'll just reiterate it again, from age 5. So from age 5, she's had this. She's had the tendency toward it. Thank you, Mom. I can already see it in your face, so it's there. So add the trauma to it, and we have what we have. And that open bite that you told us about, is significant because it tells you muscle is very unhappy, but we're about to make it happy. So we're going to end the exam now, and then we're going to go in the other room and we're going to get her ready for the K7 neuromuscular component.